Somebody has to humor me for a second because I'm having like a midnight rant right now. I started my hair last night and I didn't finish, so don't pay no mind to me. Is that better? I don't know. I'm distracted. Anyway, check this out. So I'm upset. And I want to know how you would feel about this and what you would do or what you would want done. Just give me your opinion. Give me some feedback. Patient came into the country 2 days ago. By the time she found me for services, she had already booked her own doctor. No big deal. We got you. So she comes into the country, we get her set up, she goes to pre-op, she goes with one of my nurses, and while she was spending her day at pre-op, there was a few different things that became concerning to us, but she didn't notice anything, obviously, because she's not up on what happens. So we started noticing little things like certain items being pushed for sale that were overpriced. We started noticing that she told my nurse companion that she didn't need to be there. That was another red flag. Like, why can't she be there? Then there was a third red flag where she told the nurse, like, tomorrow she doesn't have to come in terms of the overnight nurse. Why not? She has her own private overnight nurse. I would hope she would be welcome there. I'm hoping that when she shows up, this is not going to be a problem. And then the patient did her whole pre-op, went through her whole day, did all her blood work, so on and so forth, and then was told that the doctor was not available to see her, but that her surgery would be scheduled for the following morning. At this point, all she's done is pass pictures through an assistant and have an assistant nurse person take pictures of her in the doctor's office naked, but she's still not met her surgeon. She has now paid thousands of dollars for the surgery. She was also denied like additional arm lipo and little additional lipos, which shouldn't have been denied, especially because she has a hemoglobin of over 14. And so all these things, right? And then when she leaves, they tell her that she should be at the clinic this morning at 5 in the morning. But not only should she be there at 5 in the morning, she should be there at 5 in the morning, and that she has to stay in the doctor's recovery house mandatory for the first 3 days. So I don't know where this comes from. They don't have much information about where she's staying. They don't know where she's staying. They don't know anything. They just have their rules. I don't know. Some of it makes me feel uncomfortable. The fact that she's there for surgery right now and she still hasn't met her doctor. They just told her that her surgery is scheduled for 11:30 in the morning, which means that there's other surgeries before her, which means that she's now hungry, fasting, awake, had to be in the street at 5 a.m. and is going to sit there until 11:30 in the morning. And hopefully at some point sees her doctor. And if you guys know anything about plastic surgery days, they tend to be rush, quick. And that's not the type of experience that I hope any of my patients will have. So I hope that when it's time for her surgery today, she gets the time that she needs to express to the doctor what she wants to do and where she's trying to go. But it's completely not what I would have liked. It's completely not my process. Stay tuned for part 2 if you want me to do a part 2 about what my process looks like and what your experience would be like if you go see one of my doctors. But tell me how you feel about this. Tell me what you would do. Tell me if this was you. Like, what would you have done this morning? Like, tell me what you would have done. Because quite frankly, I'm not giving anybody thousands of dollars until you actually see me and until you and I are on the same page and you tell me that, yes, you can give me what I'm looking for. Otherwise, I could care less what the analysis say because I know I'm healthy. Otherwise, I wouldn't be here. You know what I mean? I don't know. Talk to me.